Hi, I'm Dr. Watson. This message is for doctors who, like me, are trying to work with the severe problem of childhood obesity. For doctors, we find that there simply isn't enough time in the day to talk about obesity at length. And now, here are a couple of tips that I found help me on the matter, and I hope they might help you if you're also trying to work on this problem. One thing you can do is have your staff plot and print out the growth chart. Give it to the parents for any child who's in the 80th percentile or higher with the calculated BMI. The second thing that can help is to avoid using the word obese. Instead say, "Mom, I think Bobby's a little heavier than I would want. Do you want to talk about it a little bit more?" If Mom says no, understand that she already knows this and it is a very sensitive topic for her. It also means that you haven't built up the trust level needed to be effective on this topic. Ask then if Mom wants to talk to a dietitian. Sometimes timing and trust are more important here, but next time you see them, make sure you deliver a message that you really care to build that trust. If Mom wants to talk, then tell them what they can handle. Don't go through a long shopping list of stuff. A doctor friend of mine says, "Consider the bowl." It's a loose translation of a Korean expression that means before pouring a lot of information into a patient, consider what they can handle first and then give them that, before giving them a giant list of don'ts. Recognize that kids feel like removing food is the same as punishing them. So replace what you take away by offering new things with emphasis on the new thing and not focusing on the taken away thing. Here's an example of some things that I've used that have worked with our patients. Number 1, convince Mom that no child can succeed in healthy eating if the whole family is not committed to it. Get the whole family on board. You can be assured that in most families, Mom is in charge of the family diet, so you gotta convince Mom. Number 2, ask Mom to start a food diary, showing about how much of every food or drink the child eats. Don't limit foods at this time, just record it for 2 weeks, but it also includes what's eaten for school lunches, which can be a big problem these days. Number 3, slowly replace milk with water for kids that are over 1 year old. Decrease milk and juice to about 1 cup a day. And don't deny, just have a cold pitcher of ice water ready to go in the fridge. It will be desired a whole lot more than soda, especially if the soda isn't refrigerated and there's no ice in your freezer. Number 4, stop purchasing junk, even if Dad wants it. No chips, no sodas, no sugar cereals. Instead, have fresh veggies prepped and ready in the fridge. This takes timing. If necessary, pre-pack Ziplocs of veggies in the freezer for later snacking. Number 5, kick the habit of fast food. No longer weekly, make it once a month. Number 6, limit breads, pastas, and potatoes in meals to 1 level cup maximum in a given meal. Number 7, never encourage skipped meals. Whenever the body skips a meal, it thinks it's starving and will pack on the fat with the next meal. 5 times a day, breakfast, snack, lunch, snack, dinner, before 6 p.m. works best. Number 8, set up a time for the whole family to go on a brisk, hour-long walk every evening. This improves social time and gets the social media iPad use down a bit. Lastly, remember that no-fat ranch is okay, but not low-fat, no fat. And then set up a dietary visit with your doctor to visit every 3 months and discuss your progress. Thanks, I'm Dr. Watson. Hope this helps. If you enjoyed what you saw today, don't forget to like us on Facebook, follow us on Twitter, and subscribe to our YouTube channel.